Hello everyone. I am 5-Minute Pharmacist. I would like to talk about the most asked 3 questions to me from the patients or their families. Taking high blood pressure medications. Working in pharmacies as a pharmacist for over 20 years, I have been meeting so many hypertension patients, and I have shared many stories with them. In this video, I would like to share my experience with people who have been diagnosed with hypertension for the first time in their lives, and have been prescribed antihypertensive medications. What do hypertension patients talk about most often with pharmacists? In the future, if you are diagnosed with high blood pressure for the first time and take medicine, what are you most curious about? Let's start talking about the best 3 questions from patients. Number 3 question. How strong or weak are my medications that I have been prescribed? Are these drugs very strong or weak? This is a very complex question that is hard to give a really good answer to. I usually don't answer it directly. Instead, I usually say this, and my answer to this is almost true. The doctor has prescribed the most appropriate and safest high blood pressure treatment for you, so take it with confidence. More than 99% of my answer is true. Best 2 question. I forgot to take my medications for a day or 2, but my blood pressure was normal. Can I stop taking my blood pressure medication now? In fact, I didn't have any problems with my blood pressure, even if I had not taken for a week. Ah yes. I have met countless patients over the past 20 years who have said the same thing. He or she said that there are many people who are fine without taking medicine. By the way, believe me, I have seen several times so bad things because they stopped taking blood pressure medicine without consulting us. I couldn't see them forever, and it still happens out of my reach. If you want to stop taking blood pressure medication, please get permission from your doctor first. Number 1 question. When is the best time to take this medicine? Shall I take before meals or after? Should I set a time and take it? When is the best time to take? Morning, evening, at night? Please just remember one thing. Please take it well according to the prescribed usage and dose prescribed to the patient, excluding extremely limited medications. It doesn't matter at all, such as before and after meals, morning and afternoon, etc. Follow the doctor's prescription and take it exactly once a day or twice a day. I usually explain it in a general way. You can take it regularly every day. That will do. Also, as you know, taking blood pressure medication is not the only thing that matters in hypertension patients. Changes in your lifestyle are also important. For example, quit smoking, low-salt diet, sufficient aerobic exercise daily, etc. There is one more common question about alternate hypertension treatment. They want to know this. Are there other ways to avoid taking this blood pressure medication? If you were me, what would you tell your patients who don't want to take medicine? I am curious about your thoughts. Let me know what you think in the comments. Finally, there is one word that I habitually mumble upon waking up every morning. Live happy today too. If you found this video helpful, please click subscribe and like once. Then I'll come back with a good video that can really help you.